We're really excited to be here to share more about the foundational public health services with all of you and really engage in the subsequent session around some skill building and really thinking about the framework of the foundational public health services and the capabilities and how that ties to kind of narrative. Saw in the poll, there's about 50-50-ish familiarity with the FPHS. And so really hope that what we'll share today is helpful for all of y'all in terms of either continuing to build your awareness and knowledge of the FPHS or kind of building that foundational knowledge. I am Rena Chudgar, pronouns are she, her, and I'm a senior director at the Public Health Accreditation Board on our Public Health Systems and Services team. And I'm joined by my colleague, Naomi, who will introduce herself when she takes over the presentation in just a little bit. Today, we're going to share an overview of the foundational public health services, share some examples of how the foundational capabilities in particular are kind of operationalized in practice, and then how the foundational public health services overall are being used to transform public health. We'll also have some time for y'all to move into breakout rooms to talk a little bit about application within your context. If we go to the next slide, wanted to start with sharing just a little bit about who we are at the Public Health Accreditation Board, or FPHAB. Our mission is to advance and transform public health practice through championing performance improvement, strong infrastructure, and innovation. And our experience really kind of is across the board in terms of transforming public health through our national accreditation and recognition programs for health departments, through fostering innovation in public health, and leading and supporting efforts around statewide systems change. And Naomi, I see the slides are in the notes view if you want to go back to them. We're one of the 3 national technical assistance providers as well, or TA providers, for the CDC Public Health Infrastructure Grant, and working closely with ASTO and NNPHI and CDC, who are the other, who's the funder, and the other national TA providers to really support all of the recipients and all of the states and locals in really kind of advancing public health infrastructure within their states and communities. And so really here with you both in our capacity as FPHAB overall and as this one of the 3 national TA providers as part of the Public Health Infrastructure Grant. Go to the next slide. I wanted to start with just a grounding in our definition of public health transformation, which was created with input from health departments that are a part of our 21st century learning community. I'll share more about that in just a minute. Wisconsin is a part of that, and really focused on kind of understanding what it means to say the word public health transformation that we hear a lot. I'm not going to read this fully, but in short, just wanted to share that it really is focused on all of the various aspects of sustaining what's working, building on what can be improved. So kind of thinking about that quality improvement lens and really reimagining what needs to be. So really thinking differently about how we're structured and how our systems and processes work to be able to create kind of the new public health of the future and really provide opportunity for folks to thrive and not just survive. And we believe that transformation in public health is really grounded in 2 frameworks for public health: the foundational public health services framework and the essential public health services framework. And I'll talk a little bit more about what those are and how they're different and what the foundational public health services is specifically when it comes to this context. So transitioning now to kind of the how of transformation through the foundational public health services. FPHAB has been and it continues to be the steward of the foundational public health services, and we're really excited to continue to steward this framework into the future to really best support kind of public health transformation, and are always open to talk about kind of what's missing from this in terms of how we describe public health infrastructure and kind of that minimum package needed for public health. I wanted to start with just a bit of history first. I think history is really important to kind of anchor and then kind of move from. And so the history of the foundational public health services really started with a 2012 recommendation from the Institute of Medicine report around the future of public health. And that report called to create this minimum package of services that refers to the suite of programs, skills, and activities that must be available in health departments everywhere for public health to work anywhere, and for which you can determine costs for what it means to kind of be spending around these foundational capabilities and areas. A group of folks, the Public Health Leadership Forum, convened in 2013 to really develop then the framework that is the foundational public health services that outlines the unique responsibilities of governmental public health and really defines those minimum set of foundational capabilities and areas that, again, must be available everywhere for public health to work anywhere. It also includes non-foundational items, or what we now call community-specific services, that describe the additionally important work that is delivered every day by governmental public health, but is related to that specific community or that specific state's needs and might not be needed in other places because it's specific to that context. We've updated the framework several times since FPHS became the steward several years ago, and have identified ways to really cross-connect the foundational public health services into all of the work that we're doing to really kind of make sure that alignment is clear. So it's a part of the FPHAB standards and measures for accreditation. It's the basis for the pathways recognition program and more. So really trying to think about how to best ensure that the FPHS are a part of everyday practice. I'll transition now to share a little bit more about the framework itself, and then Naomi's going to go into specific examples within each of these, so that'll be coming. So the FPHS framework outlines the again, foundational and unique responsibilities of governmental public health. The role governmental public health plays in the delivery of services might be different by agency to agency, community to community, or system to system, state to state. These really define what's the responsibility of government, but how those are delivered is really kind of dependent on like that specific community or state circumstances, and really where there's a role for thinking about both governmental and non-governmental agencies, both kind of governmental public health and others as well. The framework consists of 4 main components: the foundational capabilities, or that bottom box across the bottom, the foundational areas, where you see these circles across the top, and then the community-specific services, which is that line that you see just above the circles, and is encompassed by equity across the border that creates kind of the border of the box there. And it was most recently updated in 2022 as we learned from learnings from the midst of COVID, from other kind of transformation efforts and more, to really kind of think about what's needed today as minimum to public health. The foundational capabilities and the foundational areas, again, I'm going to keep saying this because I think it's an area that is really important to emphasize, really help define the minimum package of services that governmental public health has responsibility for being available in all communities. Again, the delivery of those can be done differently across a statewide system. So all of the health departments within the state, across a single health department, or in collaboration through a variety of other models. This is where partnering with others in other sectors also comes into play too, like community-based organizations, academia, and others. We have also been thinking about and working with health departments and statewide systems around how to use this framework to undertake transformation efforts, and really thinking about how it's both a framework that describes, but also a framework that can be operationalized to use to really undertake concrete steps towards public health transformation, which includes things like understanding what the current capacity is around the foundational public health services, what's the current costs that are going towards these, and if we wanted to fill that capacity gap, what would that cost, and how do we continue to plan using those data to kind of build our capacity expertise and really think about how we're allocating resources. The components that we'll continue to explore are made up of work that you may already be doing, you likely are already doing, and really encourage everyone as we're going through both the specific components and then the examples later to think about kind of your role and what you're doing and how they fit into these different buckets. Before I describe each of the different parts of the framework individually, I did want to just spend a minute thinking through these two frameworks specifically and really talk about the distinction between the 10 essential services and the foundational public health services frameworks, as this is an area I think we often get questions about and it can be a little bit kind of confusing in terms of, well, why do we have these two frameworks? There are definitely similarities and alignment, and both were developed for different reasons and purposes. These, as we said earlier, still, we believe are two kind of guiding frameworks for public health alongside other frameworks for how we do our work that might not be specific to public health in terms of what services are provided. And really want to highlight that, and we'll dive into this more in term when we get to the narrative portion, that, you know, really thinking about these frameworks as a tool and a guide to really frame and do some of our work, speaking from a common language, which again, we'll talk a little bit more about what it means to have a common language, what it means to have these messages. And there's still space for kind of transformative change, regardless of having these containers from which we work. So wanted to highlight that. So the 10 essential services are the range of public health services that should be available to a community. Delivery of the 10 essential services is the responsibility of the entire public health system, not just the governmental public health portion of that. So it includes other system partners. For those of you who may have been in public health for a while, you may recall the jelly bean or the bubble or the egg diagram that included kind of a variety of the public health system partners across sectors. And that's really kind of who we think about when we think about who's responsible for all of the parts of the 10 essential public health services. For the foundational public health services, again, these are the responsibilities that are unique to governmental public health departments. And again, consider those minimum or core public health services that should be available everywhere. And also think about the foundational capabilities as the infrastructure that's needed in public health. So just wanted to talk a little bit about kind of the relationship between these two frameworks, and they're aligned and related, but serve different purposes. We go to just, so just wanted to show this in a different way. The essential public health services, again, is that framework for the entire public health system. The foundational public health services really describes that framework for governmental public health, and it's a subset of the essential public health services. And then FPHAB has our standards and measures, which are grounded in the essential public health services and the foundational capabilities. So just wanted to share that visual if it's helpful to see kind of the interconnection between these. And just briefly wanted to touch on the next slide about the connection back to the public health infrastructure grant and thinking about all the work that is underway in Wisconsin around assessments, workforce assessment, understanding kind of emerging training needs, and all of the other work that y'all are thinking about is related to through the infrastructure grant, falling into each of these three strategy areas: workforce, foundational capabilities, and data modernization. Wanted to pull out foundational capabilities in particular, as that really is kind of the crux of part of the infrastructure grant and what we're talking about today, and wanted to kind of show that alignment. I would also say I think workforce is embedded within the foundational capabilities within that organizational administrative competencies bucket, and so see alignment with the workforce strategy as well. And then of course data modernization when it comes to implementing the work of the capabilities in the areas is essential for that. We'll move to the next slide, and I'm going to kind of breeze through this one just to keep us moving here, but wanted to share, and y'all will have these slides, wanted to share some ways in which we're seeing the foundational public health services as useful for public health system transformation. used as kind of a way to provide some consistency in how we're talking about the various components of those responsibilities, helps to understand and assess in a common way, kind of capacity and costs, and more. So you can read more of these here. And I'm going to move us on to the next slide. So again, I'm going to just briefly talk about the 4 components and what they are, and then we'll transition to Naomi, who will share more details about each of these. So again, the foundational capabilities at the bottom there are the cross-cutting skills and capacities needed to support public health protections, programs, and activities, key to ensuring community health, well-being, and achieving equitable outcomes. We know that health departments and kind of the system serve communities and require really strong infrastructure, just as any other sector does. And the infrastructure really is seen as those foundational capabilities to really do the work that's needed by public health to support preparedness and policy planning, and kind of robust lab capacity and partnerships with community. And so really essential to have that infrastructure in place in order to be able to effectively then both implement the foundational areas, which sit right above it, and all of the additional work, the community-specific services that are going on every day. On the next slide, we'll highlight the foundational areas. These are also referred to as programs, are the basic public health topic-specific programs and services aimed at improving the health of the community. They reflect the minimum level of service that should be available in all communities. And I'll note here the emphasis on that, whereas in the next slide, we'll talk about community-specific services. And so these really are what's needed everywhere in terms of programs and the infrastructure for programs for public health to work anywhere. On the next slide, we have community-specific services, and these are those local protections and services that are unique to the needs of a community. These services are essential to that community's health and also vary jurisdiction to jurisdiction, state to state, system to system. And really just want to emphasize again that community-specific services are just as, if not more important than the foundational capabilities and foundational areas. But without that infrastructure in place, so without those foundational capabilities and without those foundational areas, these community-specific services are likely not going to be able to be implemented as effectively or efficiently or equitably. And again, just to highlight this, services that may show up in community-specific services are not considered foundational because they're not as important. It's just because they might be or are more specific to a specific community's needs. And then finally, wanted to share the equity, the box around the framework as the 4th component. And again, the public health system really should serve everyone and requires intentionality to embed equity explicitly within all of the components of the foundational public health services. And so really see that box around the framework as the lens through which all of the work should be done and implemented. And then also calling out specifically that there is a foundational capability that is equity as well, really emphasizing the infrastructure needed to be able to do equity work. Before I transition it over to Naomi, wanted to just highlight that there is so much great work going on in Wisconsin related to the foundational public health services, from kind of the broader transformation landscape, understanding kind of capacity and spending and workforce around the foundational public health services, and in implementing foundational capabilities and areas activities. Wisconsin is a part of our 21st century learning community, which we're always so excited to have. And that learning community is really focused on public health transformation across the statewide system. And Wisconsin is a part of it alongside 17 other states. So kind of really who we think about as great leaders in the space of thinking about public health transformation. And we also have 22 accredited health departments from Wisconsin as well. So I will now transition it over to my colleague, Naomi, who's going to first introduce herself and then share more about the specifics and examples from each of the parts of the framework.
Thanks so much, Rena, for really laying the groundwork for what the FPHS are and the foundational capabilities specifically. My name is Naomi Rich, and I'm a program specialist at FAB on the Systems and Services team. I spend a lot of my time working on initiatives related to the FPHS and transformation. So I'm really excited and grateful to be here today to dive a bit deeper into the foundational capabilities and how it relates to work that you're already doing in your community. If you have questions throughout or thoughts related to any of the foundational capabilities or the FPHS in general, please do feel free to add them to the chat. I am going to do a quick review of foundational capabilities again. As Rena shared, each component is equally important, but we're focusing on the base of the framework today because of the connection to your work, how it's built into FIG, and really how it holds up the other areas of the framework by having that strong infrastructure. Activities within the foundational capabilities need to be provided by the public health system, which Rena mentioned, but it is not prescriptive to who within the system provides each capability. Part of why everyone is here today is to contribute to the conversation for the public health system in Wisconsin to figure out what works best for your public health system. On screen now, we have all of the 8 foundational capabilities. Its definitions play an important role in assessing the FPHS, and it's really important for Wisconsin's public health system to do and continue to look back at the definitions and do this together so that you really understand what you're talking about when you refer to each foundational capability. We have our national model to look to for what it looks like and what others are doing, but as we know, each public health system is unique. I'm going to do a quick poll now to get a better understanding of your area of interest at this moment. And ask which foundational capability are you most interested in learning more about in action, or what we would say operationalizing. I love seeing how it changes and how each vote makes a difference. So we'll give it about another 15 seconds. And it's great. We see community partnership development as one of the areas of most interest, which is great since we have a lot of different community partners here today. And then we have policy development and support, and then it looks like equity. That's really great to just know where you are coming in from. So thank you. So, sorry. Now I'm going to do a quick review of each of the foundational capabilities and provide a couple of different examples for the 2 areas that you expressed that had the highest area of interest in. I'm going to spend a little bit more time on examples. So accountability and performance management. That foundational capability includes measuring what a department or public health system is doing to assure objectives are being met. This includes how a department embraces use of quality improvement tools and builds a culture of quality. An example of what this could look like as an activity is creating accountability structures and internal and external equity-related measures. The next capability, and I forgot to mention, these are not in a specific order. They are all of equal importance. Alphabetizing just didn't look quite right in the graphic. So assessment and surveillance includes the ability to collect, assess, analyze, and interpret data that describes the community served and the factors that influence the health of those communities. Surveillance is about using the data to detect emerging issues or trends that affect that community. And examples of this foundational capability include conducting a collaborative community or statewide health assessment and identifying health priorities. The next foundational capability is community partnership development. This includes the ability of governmental public health departments and systems to engage with each other to address public health needs. This may mean the department or system should be bringing other groups to the table. It could also mean that the department is a good partner who demonstrates a willingness to engage with others to address public health issues by bringing a public health perspective to the work. Examples of this could include leveraging and engaging partnerships and community in equity solutions. It could also include establishing and maintaining trust with and authentically engaging community members and populations, convening across governmental agencies to promote health, prevent disease, and protect community members, or engaging members of the community and multi-sector partners in a community health improvement process. This is really about working together collaboratively to identify solutions that are best for your communities, and we know that communities know their communities best. The next foundational capability is communication, which includes different communication strategies, such as the ability to communicate in an emergency and on an everyday basis. Communication needs may be tailored to particular audiences and could occur over social media, in partnership with the press, or in person. And it's important for health departments or public health systems to be able to receive and transmit important information on a 24/7 basis using plain language. An example of this foundational capability would be writing and implementing a routine communications plan. As I hope you're starting to hear, some of these examples are things that you're likely already doing. So I really encourage you to think of other ways that what you're doing fits into this framework. The next foundational capability is emergency preparedness and response. This includes activating and responding to an emergency and the ability to communicate during an emergency, work with other response partners, and sustain the work of public health while in the midst of preparing for or responding to disasters and emergencies. I think over the past couple of years, we've really seen this foundational capability play out, and now is the time to really learn how it relates to the other foundational capabilities so that we can focus on maintaining and sustaining the work of public health during emergencies. An example of this includes establishing and promoting basic, ongoing community resilience and readiness and preparedness efforts. The next foundational capability is equity. Work on equity requires that in every area of work, a public health department or system integrates aspects of equity, assuring inclusion in policies, programs, and services. This includes helping others to understand how issues of equity can be addressed to achieve a healthier community. Examples of this activity include strategically addressing social and structural determinants of health, working collaboratively across the department and community to build support for and foster a shared understanding of equity, or creating a shared understanding of what creates health, including structural and systemic factors that produce and reproduce inequities. The next foundational capability is organizational competencies. This includes strong leadership and strong local board of health. Information technology capability and safeguards should be in place to address public health workforce needs, like training and human resources functions. Having a good financial system in place and access to legal services are also included in this capability. An example of this foundational capability would include effectively advocating for policies that address social determinants of health, health disparities, and equity. This foundational capability, policy development and support, includes bringing the public health voice to policy development and advocating for policies that can affect the health of the community. Enforcement of laws and policies in a fair manner is included in this capability. A couple of examples of what this could look like are collaborating with partners, policymakers, and community members to develop or update public health policies that are practice, experience, and or evidence-based, and consider the perspectives of individuals with lived experience. It could also look like convening cross-sector partners to identify strategies or initiatives for governmental and non-governmental partners to implement to address health in all policies for the population. Or it might look like monitoring and reporting public health violations and enforcement responses and notifying the public as necessary. I now have a bit of an interactive activity. There's a few examples of foundational capabilities on the screen. And as I read each example, I encourage you to add the foundational capability that you think it aligns with to the chat. So first we have your epidemiologist provides data on the percentage of children who have all required vaccinations. If you want to just take a minute and add the foundational capability that you think that aligns with. And I'll review these. The next one that we will discuss is the Human Resources Development Department conducts research and provides recommendations for staff raises or salary adjustments. This is a different foundational capability, but if you have thoughts on which one this example might align with, please add them to the chat. And the last example here is health department staff participate in a drill with community partners about a severe weather event that affects your community. I'll give it about 5 more seconds before I show the answers, but it looks like that we definitely have some people who are seeing the alignments in the chat, so thank you. The first example is, in fact, assessment and surveillance. The second example is organizational competencies, and the third example aligns well with emergency preparedness and response, so thank you all for participating. I'm going to use the next couple of minutes to share a couple of examples of foundational capabilities in action. These come from our 21st Century Learning Community, which, as Rena mentioned, Wisconsin is a part of, really leading work around the foundational public health services. So representatives from Wisconsin are connected to folks from the states I'm going to share examples to, and we're also happy to help make connections if there's something that you'd like to learn a bit more about. So I'm going to start with the foundational capability of equity in Minnesota. They have just closed the application period for round 2 of what they're calling innovation projects. The Minnesota legislature provides $6 million in annual funding for local and tribal health departments to strengthen their public health system and create a system for the 21st century. They are figuring out what this means and what it could look like through funding projects that provide insight into efficient and effective ways to ensure Minnesota's statewide public health system has the expertise, skills, and capabilities it needs to meet new and emerging public health challenges. They've already funded 10 projects in their first round, and a couple of examples include piloting a regional planning and communications team that will strengthen the jurisdiction's ability to measure, evaluate, and communicate, as well as piloting a consultation model for building data capacity and strengthening community partnerships. So we will share a link to the website that talks more about these examples and can really go into depth on what this has looked like. And we look forward to seeing more outcomes and how this how learnings are implemented across the state and what they can mean for other states. In Minnesota, to operationalize communications and organizational competencies, they've launched the We Are NC Public Health campaign. This campaign aims to increase awareness of careers in governmental public health and highlight the essential role public health plays every day in the lives of North Carolinians. This effort is multifaceted, but has support for those who wish to use its resources. I really encourage you to check them out on LinkedIn, and we can also share a website with this. But there are some tips and resources that might be that are adaptable to other public health systems as well. In Oregon, they are operationalizing equity in a different way. They are using their investments in public health modernization to help prioritize this. They've invested $50 million for health equity in the 2023 through 2025 biennium through their modernization efforts. And to actually make this work happen, they are focusing on working regionally and providing culturally specific public health responses, engaging in statewide health equity and workforce planning, and more. They really believe and have found that partnerships are key to make this work. To learn more about some of the evaluation related to this, at the end, I'm going to share a link to a learning module, which FAB hosts, that really dives into some of the results and impacts and outcomes that they've seen related to this, and that will be updated with time based on this specific investment period. And the last example that I'll share today is related to the Communications Foundational capability in Washington. They have what we call Public Health is Essential. And to operationalize this foundational capability, and the foundational capabilities in general, the state legislature has invested in core public health system services. And the state uses this campaign to continuously demonstrate the role of public health and the need for increased funding. This campaign, Public Health is Essential, has easy to share videos and materials about the public health workforce and communicate about what they do so that folks in their public health system have things on hand when they need it. I'm going to turn quickly now to a few ways that FAB can support transformation work. The FPHS are part of what FAB refers to as our tools for transformation. We offer a range of support to health departments and public health systems, and we are really glad that Wisconsin is already engaged in many of these opportunities, so that as a system, you can continue to operationalize and see where you are at in advancing and transforming your public health system. You can learn more about these different tools and how they can be used at your system level and by health departments at the FAB's website. And lastly, I just want to mention a few specific FPHS related resources that I encourage you to check out to learn more. The module, which we'll add to the chat now, is a free e-module that is available. It is continuously being updated with different examples of what it looks like. So you can see examples from Wisconsin and all of our 21 C states about operationalizing it. This module is really great for folks, no matter their engagement with the FPHS or familiarity, and has information for people who are hearing about it for the first time and folks who really want to dive in and take their knowledge to the next level. I want to thank you on behalf of FAB, Rena, and myself for showing up today and doing the work that you're doing to transform public health in Wisconsin. We appreciate you and hope the FPHS can continue to be used to help with your transformation. Thank you again, and I turn it over now, I think, to Annie.
I'm curious, we're a little bit ahead of schedule, and since we have Rena and Naomi on, if folks have questions for them too, if Rena and Naomi are open to that, whether you drop them in the chat or hop off mute, I think we have some time for that as well.
I'd love it if Rena or Naomi would speak to the element of the infographic that I find most interesting. And we've talked about it a couple of times, but I think it's worth calling out in this space that equity, I call the foundational capabilities bricks. Equity is a brick and equity outside. And could you talk a little about the history of that? Like when did that change happen and what prompted it?
Yeah, happy to. I can jump in first, and Naomi, please jump in as well. Thanks for that question, Annie. I think the two components where equity is kind of visibly seen in the framework. One is the kind of brick or the infrastructure of the foundational capabilities, and that is really intended to ensure that, if we're thinking about there's resources needed to build this infrastructure that's needed for public health, ensuring that equity has those resources dedicated to be able to like build out the infrastructure needed to support that work as well. And then the box around it is the lens and framework that should be embedded in all components of the framework. So the capabilities, the areas, and the community specific services. And I think harkening back to kind of the original version of the infographic that was created in 2013, the words weren't explicitly maybe included as either a brick or a framework, but were considered to be embedded. And as I think public health has deepened its equity work over the last, let's say 11 years since the framework was first created. We talk a lot about equity being both a lens and a focus area, and really wanted to ensure that kind of focus was a part of the visible part of the framework and not just kind of lost in the kind of buckets of the other capabilities and areas and community specific services. And so it kind of really is, the focus and the deepening work that public health has undertaken has kind of pulled out the importance of both the lens and the like focus as a strategy. That's kind of where the evolution of the framework has come. And I think it's a both and to really encompass the need to have the brick or the infrastructure and the resources dedicated to be able to do equity work. And so that's why it's a brick or part of the infrastructure. And then the circle, which means in every single foundational area and every single foundational capability and all of the community specific services, equity should be a part of how that work is rolled out and not seen as like separate from it. So that's really the kind of the encompassing part of it. So that's my thought on how fully that answers your question, Annie.
That's a great answer. I love it. Thank you so much. I actually, when you said, I think you called them buckets and I called them bricks, but that makes it a part of infrastructure. And that finally clicked for me. Like, so beautifully done.
And one thing I'll add is that before this was revised, other states that were using a similar model of the FPHS were really starting to see what it would look like. And there was a lot of conversations on, is it a brick? Is it a circle? Is it both? And that's where it landed because it is so important in the infrastructure and in the entire public health system. So a lot of discussion from folks in the field, and hopefully we continue to see it embedded more and more throughout each component as the FPHS is adopted throughout the United States.
Hi, this is Peggy Helmquist, and I'm kind of going back to that mental health piece that I did put in the chat. And I kind of would like to know, a little bit more when the foundational areas were put forth. I mean, we've been doing mental health connections in public health. I've been in public health for probably over 35 years. And so we've done a lot in the arena of mental health and those connections. And I'm just wondering, why that wasn't a stronger link with either the foundational areas or the foundational capabilities of what that really is and how that would be a foundation when you're looking at public health is mental health and vice versa. So I kind of like a little discussion on that, if you don't mind.
Yeah, happy to share. And I think this is a question we often hear. And I think as we continue to learn from the field in terms of what is needed everywhere for public health to work anywhere, I think the framework will continue to evolve. And so just naming that, it's evolved from the 2013 version to the version it is today is both what is changing in terms of what's minimum and foundational is kind of learned and thinking about how we best support use in the field. I think part of mental health work falls into some of the areas that are listed here. And so you think about kind of the work within chronic disease and injury violence prevention, can't speak. So all of the different areas, not just that one. I think part of it is embedded in there, and I think part of it is within community-specific services. Again, naming that community-specific services are in a lot of places like more important than the foundational capabilities or foundational areas, if not equally important. So it's not meant to elevate these named areas as different, but really showcasing what's needed everywhere for public health to work anywhere. And so I think part of like the infrastructure pieces of mental health might be embedded in, some of the aspects of the capabilities. If you think about, policy, all of the pieces, and in some of the areas that are named. And I would say as we continue to evolve as a public health field, there might be opportunity in the future to think about, what are additional areas that we need to add in here that really are essential or foundational everywhere for public health to work anywhere. And then I know, and we're really kind of trying to have a stronger kind of point of view on not modifying the framework. Because I think the challenge with that is as different states might modify frameworks, it gets harder and harder to understand kind of collectively what public health looks like and what we're talking about when we're talking about what's minimum for public health everywhere across the United States. But we have seen a few, especially those states who have been working with the foundational public health services for many years, do some tailoring to the framework to adopt to their kind of state-specific circumstances. And, I think maybe including mental health as another foundational area based on kind of how that state operates. So that's, my thought on that. And I think there's continued kind of thinking about, the next time the framework is updated, what might that look like? And what do we know now is foundational to public health?
I think mine is actually very similar, Rena. Maybe talking through a little bit about how the foundational areas were determined. I know that happened a long time ago, but in Wisconsin, at least there at a local level, there has been a fair amount of discussion, not only about mental health, but substance misuse as two areas that have been increasingly important for our prevention and early intervention work at a governmental level. And I think some struggle because it's not easy to see where that fits in areas. So maybe just a little sense of the start of the areas that are there, and if something like mental health substance misuse is being considered.
Yeah, I was involved like kind of in the work when it was first created. So y'all are making me like pull my 2013 memory a bit. And I think like the conversation really centered around across every single place in the United States, what needs to exist. And this is not to say that like the work on some substance use disorder and mental health shouldn't, but I think in 2013, the conversations were around, across this country, what can we say needs to exist everywhere as foundational? And then the community specific, at that time, they were called kind of below the line because the graphic had this like dotted line, below the line, which was the foundational pieces, and above the line, which was like additionally important work. And that's where, it might vary on how and what level of focus substance use and mental health efforts are occurring across the community, across the state, and from state to state. So I think that was kind of the reason why there was the focus on these areas in terms of a national framework. And I think as we've continued to learn and evolve, there's opportunity, I think, as we move into the future to really think about like how we're thinking about what's foundational differently, or in addition to kind of what we have today. So I know that's probably not like a great answer, but so I can pull from my recess.
Awesome. Thank you all for bringing those questions, and Naomi and Rena for taking the time to answer them. This is an amazing opportunity